Okay, so here we go on geriatrics. So we'll get started here. All right, we just did pediatrics, and now we're going to geriatrics and the other spectrum. So as we know, it's an aging population, and they have a lot of physiologic changes. Most all of it is reduction in physiologic changes in the body. So things just are declining. When we think of aging, we think of declining. So the liver mass, how it's working, kidneys, total body water, your fat increases. That's about the only thing that increases, right? Me getting older, I can attest to that. But your muscle mass goes down, fat goes up. So anyways, just to let you know that. Now, let's go over the pharmacokinetics. That fun stuff you like, right? Absorption, distribution, metabolism, and excretion. Again, everything that I have in red, just please pay extra attention to and really try to understand it. So when we're thinking of geriatrics and absorbing medications, if you're taking it by mouth, for example, you have a decrease in your surface area of your small bowel. Your gastric emptying is decreased. Gastric blood flow is decreased. Your pyloric sphincter, that is, remember, right above the stomach in the esophagus, that opens and closes, that lets food get in and out. That doesn't work as well, so a lot of elderly maybe have to eat smaller meals or get more reflux. And also the acid production is decreased. Then it's distributed into the tissues, then it's metabolized. And remember with metabolism, remember that half-life we talked about? You're going to need to know the half-life and understand that how long it takes for half the drug to be effective in the body. So the drug life, the half-life is lengthened, so it's going to take a lot longer, and that's why they can develop toxicity to the drug. Metabolized, remember most drugs are metabolized in the liver, and if your liver function and liver mass is decreased, that can cause toxicity because it's just not metabolizing the drug like it should. So it can actually accumulate and cause toxicity. So we want to monitor liver function tests for medications. And then how is it excreted? Remember the kidneys? And if their renal functions decrease, they can again have accumulation of the drug. So we want to make sure we're monitoring their creatinine. When we say serum creatinine, that's saying blood creatinine. You're going to draw their blood, which is usually a metabolic profile, which assesses their BUN creatinine, and as well as other electrolytes. Regardless, elderly in general are at increased risk of drug toxicity. As we go into pharmacodynamics, how the body is affected, they can have central nervous system. They're going to have more side effects, not necessarily an allergic response to it. They're not at an increased risk of that. You can have an allergic reaction to medicine at any age, so it doesn't put them at increased risk. It puts it more of increased risk for adverse reactions because of the aging body and how it's being affected by the medications. Remember we talked about drug receptors, the protein. There's 4 different ones that the drugs can bind to, and so there's a decreased number of those. Also, the sensitivity of it, so it may not work as well because everything in our body ages as we get older. And just our response to, as we get older, our response to the medications are different. So how are we going to monitor this? So drug dosing monitoring is a little bit more tricky. It's similar to the pediatric population, although it's, we deal with a lot of geriatrics. So it depends what area that you're working in. But you're going to see geriatrics taking multiple medications, whereas you're not going to see that in kids. So polypharmacy is really big. So it's taking multiple medications. You know, when I see patients, sometimes I look at their med list, I'm like, oh my gosh, they take 30 pills a day. It's just crazy. And there's major polypharmacy party. Yeah, there's a party going on in the body, right? Major polypharmacy going on. So there's a Beers criteria. It's the Beers list. It's been out for a long time. It is basically gives you a list of medication that you have to really be careful or should be avoided in the elderly. Not to say that they're never on any of these medications, but you need to be so careful because of how your liver is not metabolizing as well, your kidneys, the drugs interact with each other, etc. They're at increased risk for adverse reactions. They can have medication errors. Because remember, they're elderly, so it doesn't mean that elderly people can't do it. There's a lot of independent elderly people that take their medications just fine. But we also have to assess for that, because if they aren't able to, then there is an increase of medication errors. There could be multiple doctors because a lot of them see specialists, maybe not communicating with each other, which they should, but in reality doesn't happen. So it's up to the primary care provider, which I am a primary care provider, to really look at all of the meds and say, all right, who's prescribing this? Who's prescribing that? Cardiologist is prescribing this. You're seeing nephrology. They're prescribing that. And I need to make sure that they're all working together just for an extra person to take a look at that. Adverse drug withdrawal events, overdoses, because they're just not taking their medication like they thought they should. Maybe not understanding how they're supposed to be taking the medications. Maybe not taking the medications, thinking they don't. Barriers to effective drug use, etc. So I'll use my father as an example. He passed away last year. He had really bad vascular disease. He's had strokes and things like that. He was a smoker, and he had end-stage emphysema, and he's had stents put in, and he was supposed to be taking his blood thinner was Pradaxa, and we had found out, like, basically right before he died that he hadn't been taking it. He ended up with ischemic bowel and died. So we didn't know, and that's one thing that was hard. I mean, he was living with my sister, but you know, it's so difficult sometimes to monitor the medications because my dad was very independent and knew what he was taking. So my sister and I keep going back. We should have done this. We should have done that. It's very difficult. But he said that, you know, it ran out and it wasn't there anymore for him to take. So, and he always took care of his own medication. So it was very difficult. That's why I feel like it's really, although family needs to be really involved, family has a harder time because sometimes they want to maintain their independence, and it could be hard for us family members to butt in all the time. So that's why healthcare providers are in such a good position to say, hey, no, are you doing this? Are you doing that? And just be a little bit more firm with them. And they listen to healthcare providers, I think, a little bit more than possibly their close family members. So when you're teaching with the older adult, you have to remember they don't see as well. They may not hear as well. They may have hearing aids. You may need to make sure that you're talking, in a tone. You look straight at them, limit the distractions, use large print. These are all things to try to keep into consideration when teaching the older adult about their medications. I don't know what the vial of life is. Okay, I'm not sure. I'll have to look that up, but you don't have to worry about that. You're going to review every medication at each visit, and the best thing to do is have them repeat what they're supposed to take. They need to have a list all the time and bring it to all appointments. They need to include all over the counter, anything that they're taking. And then we want to make sure that the dosing is as simple as possible. So taking something 4 times a day is a little bit harder than taking all of the meds at the same time in the morning, and maybe just a few at night. We have to make sure, watch for confusion of, when you prescribe new medications. Try to think of things that they can do to remember their medications, which we'll talk about in a minute. So you're going to do your assessment. It's real important to make sure, as we just talked about, any sensory or cognitive barriers. Lab results need to be reviewed, especially a liver function and a kidney function. That's your creatinine. Because remember, the distribution and excretion, the metabolism of the drugs are liver and kidneys, right? And then you want to get to know the whole person. And that's what I like about nurses, because we are good and we're holistic. And we not only just see the patient sitting in a hospital bed, we're thinking about how are they living at home. We need to look at the whole picture. Do they have money? Do they have transportation? There's so many things to look at that some physicians, get really focused on just diagnosing and treating and then forgetting about what's happening on the outside. Then you have your nursing diagnoses, and we want to do some planning. But let's go over nursing interventions. These are important. So we talked about lab results. You want to watch for adverse reactions. We want to try to decrease the amount of medications as possible. Sometimes it's just not possible, but we want to try to as much as possible. We want to make sure that if they're taking over-the-counter medicines, they need to tell us, and they need to make sure that the provider, the physician or nurse practitioner or PA says, oh, it's okay to take that. A lot of times yes, over-the-counter medications are considered to be safe, but yet when you're thinking about certain populations, they're not as safe if you're not getting it reviewed by someone that knows your entire med list and and can look up the interactions. So a good idea to help elderly patients with their medications is to ask them to record all of them and the times they are taken. So we can develop like a simple list for them and make it really easy in big font. You can make it in a Word document or whatever you would have, and they would record all their medications and the time it's taken. It just is easier. You write it down in big font, they can see it and know what times they have to take it, and then they check it off. Because then that will help them not forget. Another easy way is to place the pills in an organizer container, because then they can just know what they need to take in the morning and at night, etc. Keep water bottles right by them so they remember to take it, and so it's convenient for them too. I think of my dad who had the COPD on oxygen. It took him a lot of energy to go to the sink and fill up the water. So it's easy. We always had a drink next to him when he would take it. Don't use child-proof caps for them. They don't need the drug manufacturer's sheets. So it's really not important at this point. They're taking the medicines and they may not understand them as much. You can talk to them about it, but it's not a priority. And then remember, try to figure out, are they independent or are they not independent? Are they dependent on people? So that's the independent elderly person would be great to develop a log for them to record the times. There's also pharmacies that'll make bubble packs, it's called, for the patient, and they will just open them up and take the pills at the certain time they're supposed to. All right, let's do some practice questions. When you're giving medicines to the older adult population, you as the nurse are aware that the physiologic changes of aging that can affect drug activity include all the following except. All right, so we're thinking of physiological changes, and it's except, which I hate those types of questions, but unfortunately it's on the NCLEX. All right, so let's go down A. So A, do they have an increased fat to water ratio? Do they have a decreased liver enzyme production? Do they have a loss of nephrons? Or do they have an increased gastrointestinal blood flow? So we want to make sure that the changes of aging affects drug activity, including all of the following. So what physiologic changes of aging can this affect? So we do have increased fat to water ratio, decreased liver enzyme production, which is true. There are a loss in nephrons, but there really is a decrease in gastrointestinal blood flow. So I'm going to put D because it's decreased. So that's the best way to go through except questions. You start with each one. Is this one true? Do they even, remember we have more fat, 20 to 40% more fat in our body. Our liver enzyme production is not increasing in elderly, it's decreasing. Remember that metabolism? Nephrons is in the kidneys. Remember the kidneys aren't functioning as well when you're elderly, so they have a loss of nephrons. But they don't have increase in gastrointestinal blood flow. Remember, everything's pretty much decreasing except for that fat. Adverse reactions and drug interactions occur frequently in older adults due to the following except. All right, so we're talking about adverse reactions, drug interactions frequently in older adults are from what? Consumption of numerous drugs owing to multiple chronic illnesses. Yes, that could happen because that's polypharmacy. B, drugs ordered by several healthcare providers. Yes, because many of them may not talk to each other, so you don't know that they're taking these other drugs that can interact. C, increased incident of allergic responses. They really don't have an increased incident of allergic responses, so I'm keeping that aside. And D, self-medication with OTC, over-the-counter preparations. So to me, self-medicating means they're taking it on their own without having the provider say, yes, you can take this. So C is the answer. They don't really have an increased incident of allergic responses. Older adults are at risk for taking many medications together. What is this called? It's called polypharmacy. That's more of a fact-based question. Which is a physiologic change seen in the older adult that has an effect on drug administration? So we're looking at what happens in the body in the older adult, physiologic change that has an effect on drug administration. So lower acidic gastric secretions. Okay, we'll keep that aside. Increased first pass effect through liver. Is it increased or decreased? I'm thinking decreased. Increased glomerular filtration rate. I think it's decreased. And a lower cardiac output. So they do have a lower cardiac output. So which is a physiologic change seen in the older adult that has an effect on drug administration? Is it the gastric excretion? I'm going to take out B and C. So is it lower gastric secretions or lower cardiac output? I'm going to say lower acidic gastric excretions. Oops. I'm going to actually look at that answer. Hold on. No, it's lower cardiac output. See? That's okay. I'm not afraid to admit when I got a question wrong. So let's read why. Lower cardiac output is a physiologic change associated with an older adult. So we do know lower cardiac output, yes. The pH increases. Okay, so they have higher acidic, not decreases, which makes sense. Okay, causing alkaline gastric secretions. The first pass effect through the liver is decreased, which we knew that. I knew that. The glomerular filtration rates decreased. Okay, so I get it. There's actually higher gastric secretions, more acidic. So that can affect metabolism for sure, but the lower cardiac output is the most important. So that's the answer for that. Let's go to question 5 now. All right. So when assessing older adults' renal function, which lab value will the nurse monitor? Now, renal is what? Kidneys. So are you going to measure the liver? No. Electrolytes? No. Complete blood count? No, because that's more infection, anemia, your red blood cells. Or D, BUN and creatinine? Yes, because that's your kidneys. That's going to best reflect how your kidneys are working. All right, so we're finished with this one. Remember to pay attention to the things that I highlighted in red here, not the red health teaching here, not that, but the things I highlighted in red. But really try to understand. I hope that this is coming together for you and really trying to understand this absorption, distribution, metabolism, and excretion and how it varies people of different ages and things like that. So, all right, that's it.